the initial goal was one that, for the most part, has remained unchanged since then, which was to provide a platform for people touched by diabetes to connect. So the use of the word "touch" by implied that we reached out, and we continue to reach out to patients, people who are caregivers, medical professionals with that limitation too, although the majority of the community is really centered on patients and caregivers.
Okay, fantastic. And that's interesting because certainly it seems that from looking at a number of activities going on, there's a real benefit to patients being able to connect with each other beyond, I suppose, what you normally see in the healthcare system, which is patients connecting with a healthcare professional or as an advisor of some sort. I mean, how do you see that, the benefit from that point of view in terms of patients connecting with each other?
It's extremely valuable, and the reason why we thought it was important to offer a space for patients to connect with each other was grounded in an experience that I myself had in a support group of insulin pump users. There were some new pumpers in the group that I could very easily relate to because I was going through the exact same things they were experiencing just a few months earlier. So that really, was a turning point, in terms of, like we knew that it was valuable to connect with patients. And when you insert a platform like a social networking platform like Ning underneath that, you multiply the ability to, to make those connections possible between patients and, eliminate, the physical barriers and, make it possible for people who may be isolated in rural areas or in countries where there may be, limitations to access. We have a lot of testimonials from members who describe specifically how they've been able to reduce their hemoglobin A1C number from a high place to a number in the 6s or sometimes in the 5s, which is practically normal hemoglobin A1C, non-diabetic hemoglobin A1C, by sheer just participating from others who are diabetes, doing it differently, and going back and discussing with their doctors and incorporating new things into the therapy.
Manny, I want to ask you about some of the way that you've built the community. It's something that we've been, really impressed with, is looking at clearly. You and the work you're doing in this isn't just about the 2 Diabetes and the s2diabetes.org website. There's a lot of other stuff out there in other social network platforms and so on, where you're sort of, I guess, connecting with people and using resources. And we saw things like the hands photos and some of the sort of videos that you've been posting and so on. I mean, tell us something about the way that you've used social media as a whole, I guess, to connect with people.
Well, initially, when we first started, we gradually incorporated other platforms with the initial goal of getting people to join the community. And that has continued to happen. That has continued to be the case through our Facebook page or our YouTube channel or our Twitter accounts. We continue to see membership impacted, and new members come and join, or simply new visitors learn about the site and simply consume content, if you may, without necessarily engaging in the conversation. But an interesting dimension that we've seen take place in the past year is while the communities have continued to grow in terms of the interactions between people who are in that same wavelength, people touched by diabetes, in the platforms have taken place just as much. So the number of Twitter followers, the number of fans in the Facebook page, and so on have grown steadily.
What did you learn? What have you learned along the way through this project? What have you learned about how best to engage people?
Well, I think the most important lesson is, and it's a confirmation of a long-time lesson, I guess, you need to remain open and flexible to adapt. I mean, you may have an idea of something you want done, and you may have some excellent data to support that, but you may find yourself needing to, steer slightly away from that direction.
What would you say were the highlights for you over, say, the last year, over 2009? What are the highlights of your work with 2 Diabetes?
We had three very gratifying moments. Two of them very connected to each other. At the middle of the year, we launched an initiative inviting members of both communities to test their blood sugar at the same time, post their results at the same time. At the time we had 14,000 combined members. We saw about 10% of them participate. We were ecstatic about it. It was a huge community moment because testing your blood sugar is a very, very personal, very individual moment. In November, we branded it in a new light. We called it the Big Blue Test, and invited several other diabetes communities to participate in the initiative through their own members on their own communities, but with a goal to break into the trending topics on Twitter on World Diabetes Day, November 14th, and we also incorporated a dimension of physical activity to the initiative. So you were being asked to test your blood sugar, exercise for 14 minutes, November 14th, the World Diabetes Day, test again, and report on the experience. And approximately 80% of the people who participated, roughly 2,000 or so people, reported a drop of about 20 points just with 14 minutes of activity. A lot of people were shocked to discover or rediscover that was possible. Wow. Some people even questioned initially that with only 14 minutes, what's that going to do? The proof was there, and it was, again, very powerful community moment and a way to emphasize the importance of physical exercise through community. The last initiative that we saw last year that was very, very special for us too was the Making Sense of Diabetes program that we launched in October. We had participants submit. We had each week of October dedicated to a different sense, sight, hearing, smell, and so on. And each week was we called on members to submit a video of life with diabetes through that sense. And we had winners each week, and at the end of the process, in time for World Diabetes Day, we launched a compilation video. This was all sponsored by Boehringer Ingelheim. They generously underwrote the program, and I'll also send you the link to the compilation video in case you haven't seen it. It was a very, very special video that helps drive the point home about life with diabetes through the 5 senses.
Manny, it's been so good to speak with you. Thank you very much.